Next, what's behind the growing concerns along the Gulf Coast about health problems connected to the oil spill? Health correspondent Betty Ann Bowser filed this story from Louisiana. The health unit is a partnership with the Robert Wood Johnson Foundation.
I just hope they keep paying me while I'm broke down.
Like most of the commercial fishermen here at the southern tip of Louisiana, A.C. Cooper has had to go to work for BP on cleanup operations. The third-generation shrimper says it's the only way to feed his family now that the oil spill has shut down most of the fishing grounds in the Gulf.
If we don't have no way to make any money, what are we going to do to pay our bills? Tomorrow, we might not have no money to pay our bills. We have kids. People have small kids and families.
But Cooper and some of his fellow shrimpers say the work is making them sick.
9 of them came in already, sickness, and a couple of them confirmed cases of chemical poison. Nose, runny nose, sore throat, nausea, shortness of breath, things in that nature.
How serious are these problems?
It's very serious. We fought tooth and nail to get jobs, but we didn't get jobs to kill anybody.
49-year-old Cooper, who's vice president of the Louisiana Shrimpers Association, is one of the few cleanup workers who would talk on camera about the health issues involved. Most said they were afraid if they spoke to us, they would be fired by BP.
We have some busters out there 4 miles from the site, the burn team, that's with us in our organization. And the sickness comes from out there, but yet they will still go, no matter what, because we're between a rock and a hard place.
No one really knows how many people are getting sick, but here in Louisiana, 143 cases blamed on exposure to oil have been reported to the state health department. 108 of those have involved cleanup workers, the rest members of the public. Some of the people have been brought here to the West Jefferson Medical Center near New Orleans, where doctors report many of the complaints have involved heat and respiratory-related issues.
How you doing? Good.
Jessica Danis has been concerned about what the cleanup work is doing to her husband, T. John's, health.
You know, because we do worry about that they're so close and they're breathing it in all day long.
Some days it might smell a little bad, but nobody got sick.
What the couple is really worried about is their 6-year-old daughter, Josie.
They say, you know, in years to come, our children can be affected health-wise, and that's really scary.
And Jessica says she's frustrated by the lack of information from local officials and elsewhere.
And that's also scary, too, because it's like you kind of feel like they're hiding something, you know. If there's nothing to hide, just come out and say, you know, everything's okay.
There's nothing like uncertainty to make people anxious, whether you're 9 years old or 90 years old.
So earlier this week, she and about 50 other fishing families went to a middle school near Venice to talk to 3 doctors from the Children's Health Fund in New York City who were there to listen to their concerns.
And there's literally a haze as far as you can see all the way to the ground. When you come out, the smell of petroleum hits you in the face.
Dr. Erwin Redlener is president of the group and also heads Columbia University's National Center for Disaster Preparedness. He says a lack of information only exaggerates people's worries about their health.
There's people that live in Lower Plaquemines Parish that have a very difficult time accessing health services. There's physical distances, no public transportation. There are people that are not insured or not well insured yet. There are costs to getting health care, which a lot of people can't afford. So there's an ongoing series of challenges.
People here have been frightened by stories they've heard in the media about the possibilities of dealing with cancer and other illnesses in the years to come.
Our lives are down here. Our kids are down here. My biggest fear is 10 years from now, is my child going to be in a wheelchair, mentally able to sit and speak and hold a conversation because of this?
Currently, there are few long-term studies that examine oil spill impact on human health. Kendra Arneson's fisherman husband was sick for 6 weeks with respiratory problems.
They're finally starting to slowly subside. My daughter has broke out in 4 rashes. 4 rashes. She has no skin problems whatsoever before this. Now she's clear. I've had her locked up in the house for the past 2 weeks.
The health interests of people in the Gulf was on the minds of several hundred doctors and scientists gathered in New Orleans this week. The meeting, coordinated by the Independent Institute of Medicine, was aimed at assessing the human health effects of the spill. There was widespread agreement that the problem is not what science knows about the problem, but what it does not. Dr. Nicole Lurie is the Department of Health and Human Services Assistant Secretary for Preparedness and Response.
The experience that we've had with dealing with so many other disasters prepares us to some extent, but not maybe as well as we would like, for what to expect in either the short or long-term health consequences.
Dr. Bernard Goldstein from the University of Pittsburgh says he's most concerned about those involved in the cleanup operations.
The kind of organs we worry about are the respiratory tract, people inhaling these irritants. Their mucous membranes get affected in their nose, their eyes, as well as the upper respiratory tract, so they'll develop a cough. We worry about some people have skin reactions when you put certain types of petroleum hydrocarbons on their skin, so again, skin contact should be avoided.
Louisiana State University's Edward Overton is also worried about cleanup workers, but he says the dangerous chemicals in the spill dissipate before they reach shore. And the general population, including people in Plaquemines Parish, have little to be concerned about.
Now, it can give you a raspy throat and make you feel lightheaded, and some people are more susceptible to that exposure than others. But it's not acutely toxic chemical. Gasoline is much more dangerous than this oil, much more dangerous. It's explosive, it contains human carcinogen, benzene, and we use gasoline every day.
Shrimper A.C. Cooper and many others we spoke to don't buy that.
Can't sit and smell this stuff. They don't tell them what's going to happen to you after 4 or 5 years. And we don't know how long, maybe a long time.
And they're worried what the future holds.
I have my sons out there working. I have my dad out there working. I'm working. My son-in-law. I have grandkids. What happens if they get sick 5, 10 years down the line and pass away? I have a bunch of kids running around here without no daddies. Come on, we all got to think about this. If you don't think about it, something's wrong with you.
To track potentially serious and long-term effects, such as the development of cancer or other illnesses, the National Institute for Occupational Safety and Health has launched the most robust monitoring system of oil spill workers to date. As of last week, more than 14,000 workers had volunteered to be part of the long-term tracking system.